children, because the fact is one of the differences this time is the number of children who are getting infected. In the United States, certainly the numbers are growing, and doctors in India too are finding that this time children are coming with the infection. Milan Sharma has more.
Omicron has led to a surge in hospitals in the United States. While the new variant of coronavirus is believed to be milder than Delta, more children under 5 years are reaching the hospitals in America. Last week, a record number of children ended up in hospitals across the US, the highest level since the pandemic began. Since mid-December, the hospitalization rate in these youngest kids has surged to more than 4 in 1 lakh children, up from 2.5 per 1 lakh. The rate among children between the age of 5 to 17 is about 1 per 1 lakh, according to the CDC. This data is drawn from over 250 hospitals in 14 states in the US.
So Omicron, again, is less virulent or dangerous than prior strains. And most children that get Omicron have no or mild symptoms. Rarely, children can progress to severe disease. It's rare, but it can happen. About 2% of the COVID hospitalizations in the United States are in children. 99% of the hospital admissions can be prevented if children were just fully vaccinated.
The US experience with Omicron could hold lessons for India. Children here too can be vulnerable. Sources tell India Today that 2 children aged less than 2 years were admitted for COVID treatment in Delhi's Chacha Nehru Bal Chikitsalaya Hospital recently.
Despite the fact that these 2 children tested positive, they were critical and admitted in the hospital. This brings in the argument that whether children can handle COVID better should change at the moment since they are not vaccinated, and also in the light of Omicron that causes different symptoms from the Delta, how much are children protected or how vulnerable they are needs to be reassessed.
Doctors say symptoms among children aged below 18 are not mild this time, though most cases don't lead to severe disease.
Regarding pediatric, severity is almost same as compared to the Delta. In adult, as compared to the Delta, severity has gone down. Probably because of vaccination, that might have contributed. So in pediatric, severity is same.
Data on children's hospitalizations has so far not been provided by the authorities in India. However, if the US data is anything to go by, children too are vulnerable to severe illness from COVID. With Milan Sharma, Bureau Report, India Today.
So how worried should we be, particularly about little children when it comes to Omicron? Joining me now is Dr. Dhiren Gupta, Senior Consultant Pediatrics at Sir Gangaram Hospital. Dr. Gupta, appreciate your joining us. When I look at what is happening in the United States, record number of hospitalizations of children under the age of 5, the rate has surged from 1.4% in early December to 4% in January. Should we be worried that what's happening in the US today could happen in India tomorrow, that children, especially tiny tots, 1 year, 2 years, could be vulnerable?
Yeah. Sandeep, let's discuss. There are 2 things, 2 issues. One is a pediatric patient having COVID infection and is suffering from something else, right? He requires hospitalization. Second is a patient who actually having COVID and COVID is leading to critical problem. So these are 2 different issues. When we talk about hospitalization, for an example, if we compare the last 2 waves, we found that, hospitalization was as in normal population. But moreover, it was just they were suffering from other disease and they were COVID positive. That's why they required admission. So if you look at the US data also, I was just looking at a study, a well-done study. As you go to the previous speaker, he said that we need standardized study to comment on. I got a lot of friends in US and UK. I got personal communication with them. So as per the COVID ailment, the disease is still mild in pediatric age group. There are many factors, especially because of innate immunity. that makes these kids less vulnerable for the severe disease, right? Now we come to the number of patients. We all know that Omicron is 5 times more infectious. It spreads like fire, and it's spreading. We are viewing this, and previously we used to have 1 or 2 members in a family. Now we have almost 100%. Everybody is suffering from the family. Now we come to the point about pediatric.
Right.
And if you look at the best study which I can quote is 2 studies, one from South Africa and one from Cleveland. And they all said that despite that numbers are great, but hospitalization in terms of percentage is still less. It may be 1/3 as compared to Delta. The problem is that even one patient requires hospitalization out of 1,000. We Indians are in million and our population. So if it spreads
No, but
like
are you saying,
then
sorry,
of course
are you saying, doctor,
it can overwhelm the hospitalization.
Are you saying therefore that the children who are coming, the little children who are coming, are also those who have mild infection? That children's immunity is there against Omicron as well, by and large? It's only those who have other. It's only children who have other issues who are getting, who may have a severe Omicron infection. Am I correct?
Yeah, exactly. And most of the pediatric patients then land up in hospital, and they are mostly because of some other problem. They are in hospital, but COVID is positive because it's in a community. But one point I want to make, especially about, say, age group between 11 to 18, what I found, because it's an observation, we are just in early phase of this transmission. So what I found that this age group, adolescent age group, is suffering from more fever and rigors as compared to young adult, as compared to the Delta, because I look after not only adult, young adult, as well as patients with comorbidity other than pediatric age group. So I found that there is a startling difference. I don't know what is the factor. It may be the vaccination that is preventing our young adults from suffering from serious disease. So this Omicron is, shifting its paradigm from elderly to adult to pediatric age group, but still it's not severe.
I'll ask you once again, I just want a final clarity. You're saying those between 11 and 18 are getting fever?
Yeah.
Is that what you're saying? They're getting Omicron accompanied by fever, but it is not. It is not something to worry about. It's not serious. Am I correct?
Yeah. Why I'm saying,
even if they are not vaccinated.
When we define, severity is defined by oxygen requirement and pneumonia. So even in a mild patient, one can have severe symptom, but doesn't turn out to be we count them as a mild cases. So symptomatology wise, Omicron is troubling little bit more than, a fully vaccinated adult.
Right. Interesting. So you're saying Omicron is troubling young adults, or those between 11 and 18, much more than it was in the previous instance where it was those above the age of 25. This time you're finding but it is mild. And I think that is important to stress. So no need to panic, but to take care at some stage. One final word, yes. One final word, yes or no, doctor, answer. Should young children also get vaccinated now, even those below the age of 12, sooner rather than later? Very quickly.
Yeah, safe vaccine is the requirement for pediatric age group because disease itself is not very dangerous. So we need very safe vaccine for this age group.
Okay. We wait to see those safe vaccines, particularly for the really young. Hopefully it will come sooner rather than later. But for now, Dr. Gupta, thank you very much for joining us and sharing your wisdom with us.